Hello, I'm Dr. Scott Trenhaile. I'd like to take a few moments to introduce you to some of the members of my team to discuss the important aspects about your upcoming surgery. Please feel free to stop the video and take notes so that you can address your concerns prior to your procedure. Thank you for your attention.
Hello, my name is Alyssa and I'm part of Dr. Trenhaile's nursing team. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. If you have any questions or concerns, feel free to contact the office.
Preoperatively, you will have a visit scheduled back in the office prior to your procedure. At this visit, you will watch a preoperative teaching video and all your questions will be answered. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. While each circumstance is unique, patients are typically prescribed postoperative pain medication and non-steroidal anti-inflammatory medications. We will provide you the prescription of your pain medication prior to your surgery to assure timely filling of the medication prior to your surgery. We ask that you please do not take the pain medication until after the completion of your surgery. These medications are for home use only and will not need to be brought with you the day of your surgery. The medications are chosen so that they may be taken together safely as long as you follow the directions on the pill bottles from the pharmacy. It is important that you inform our healthcare team of all medications that you take on a regular basis, including supplements and over-the-counter medications. You may be asked to stop some of these medications prior to your surgery. The day of your surgery, please come to the procedure with a driver that can stay throughout the entirety of your case, as this is an outpatient procedure and you will be going home the same day. Please make sure to wear loose-fitting clothing that was easy to put on after your procedure. If a shoulder procedure is being performed, an oversized button-down shirt is best the day of your surgery, as it will comfortably fit over you and your pillow sling. Surgical patients typically receive general anesthesia in which you will be completely asleep. In addition, it is usually recommended that a regional nerve block also be given in combination to the general anesthetic. During the block, you will be able to breathe on your own, but will be unaware of the block procedure taking place. Generally, I recommend the nerve block as it should provide numbness that typically lasts 12 to 24 hours in duration. This will allow you to start your oral pain medication at home as directed while the block wears off. Starting the oral pain medication as the feeling begins to return allows for a smooth transition between the regional block and the oral medication. Side effects of the block also include the inability to move your extremity to include fingers and toes depending on an upper versus lower extremity block. The inability to move your extremity typically resolves when the feeling returns or possibly sooner. It is very common for patients undergoing upper extremity blocks to experience some pain in the armpit region after surgery, as the nerve block does not provide relief of pain in this area. Basic risks associated with the surgery include but are not limited to things like blood clots, infections, hematoma, failure of the procedure and/or implants, including loosening of the implants and dislocation, nerve damage and fractures, and need to repeat surgery. These risks are low, but are known risks to the procedure. As we get closer to your surgical date, your time for surgery will be released. If your surgery is on a Monday, you will receive a call from our office prior to 3 p.m. on the Friday preceding. For all other surgery dates, you will be notified by 3 p.m. the day before the surgery. Remember, nothing to eat or drink after midnight the night before your surgery. After shoulder arthroplasty surgery, you will be placed into a pillow sling. This will need to be worn constantly until the nerve block is worn off in order to protect your shoulder, elbow, and hand. Plan on wearing the sling for approximately 6 weeks for total shoulder replacements and 2 weeks for reverse shoulder replacements after the surgery. If for some medical reason you are in need of admission, you will be admitted to the orthopedic surgical unit after surgery, where you will be cared for by an amazing team of nurses. There, you will resume home medications and begin a regimen of pain and anti-nausea medications that will be ordered for you. Inpatient procedures typically require an overnight stay in the hospital. After surgery, there are times when the sling can be removed. It is safe to remove the sling while seated in a chair, using a computer, feeding yourself, or using the restroom. At all other times, it is important to wear the sling for activities including walking and sleeping. Avoid exercise and driving until you are seen back in the office 7 to 10 days after surgery. The dressing that is applied is waterproof and will keep the incision clean during the healing process. Occasionally, some drainage may present itself on the bandage. If this were to occur, the bandage should not be removed, but instead reinforced with more bandages. The bandage is to be left in place until you are seen on your first postoperative visit. You are allowed to take a brief shower with this bandage on your second postoperative day. If you have any questions or concerns about the amount of drainage that is occurring, please call the number provided to you. To shower, the sling is removed and the operative arm is allowed to hang down by your side. The arm is safe as long as you do not attempt to move it in any direction. Bending at the waist to allow the arm to move away from your body using gravity will allow safe access to the axilla for cleaning. At this point in your recovery, I do not recommend any prolonged exposure to water, including bathtubs, swimming pools, or hot tubs. After the shower, you may towel dry the surgical site. Don't try to clean the operative soap from your shoulder as it has to exfoliate or wear off with time. At your first post-op visit, x-rays of the shoulder will be taken and our nursing staff will remove the waterproof dressing. We will also discuss with you the next steps of your rehabilitation process, including when to initiate physical therapy. Total shoulder arthroplasties typically begin physical therapy around 4 to 6 weeks post-operatively, depending on what was found at the time of your surgery. For those undergoing a reverse shoulder arthroplasty, physical therapy is optional at 4 weeks and oftentimes unnecessary. A typical rehabilitation course runs approximately 3 to 4 months. At the conclusion of this, it is important to note that shoulder remodeling continues over the course of 1 year after surgery, and it may take a full year to achieve maximal use.